As people who work in long-term care, you know how serious flu can be for our residents. Flu infection can also be serious for staff and their families. A current flu vaccine is one step you can take to greatly reduce your risk of infection and serious illness. Here are 4 questions to ask yourself when it's time to get a flu vaccine. Is missing work a problem for me? Influenza, or the flu, is a respiratory illness, while a stomach flu is a common name for viral gastroenteritis, which is an infection of the stomach and intestines. The two are caused by different viruses and have distinct primary symptoms. Influenza causes fever, cough, sore throat, and body aches. If you have influenza disease, you should not come to work. About 3 out of 4 workers miss work due to the flu, usually 1 to 4 days. Additionally, about 3 out of 4 workers stay home at some point to take care of loved ones with the flu. If missing work would be a problem for you, you can choose to get vaccinated. If you have a sore arm or muscle aches after vaccination, you can take a medicine like ibuprofen and still come to work. Is spreading flu to my family or residents risky? If you get the flu, it's possible you will spread it to others at home or in your workplace. They may become ill. The most common complications from influenza include pneumonia and bronchitis. About 1/3 of adults hospitalized with influenza develop pneumonia. Some of us have kids who can't miss school, a spouse who can't afford to miss work, or parents who are older. To reduce the risk of spreading flu to them or the residents you care for, you can choose to get vaccinated. Do I have any underlying health problems, such as obesity, diabetes, asthma, or heart disease, that increase my risk of serious flu? If so, you are more likely to have a serious case of flu, even if your condition is well managed. No one wants to spend hours in an emergency department waiting room with everyone around them coughing. In the winter, about 1 in 6 people in the emergency room has flu symptoms. For adults, flu vaccination prevents about 56% of doctor visits and leads to 51% fewer hospitalizations. To avoid a long, unscheduled visit to your hospital's emergency department, schedule your flu vaccination as soon as your pharmacy or worksite will give it to you. Am I avoiding the flu vaccine because I'm worried about injection pain or side effects? If you hate shots or needles and you're younger than 50 years of age, consider getting the nasal flu vaccine. Your doctor or pharmacist can help determine if this is the best vaccine for you. 20 to 30% of adults avoid vaccines and getting health care because of fear about pain and needles. If you're worried about pain from shots, here are some tips to manage that safely. Bring a family member or friend to distract you. Apply a numbing medication before a vaccine. Ice the area where you'll receive a shot. Consider a shot blocker device that can reduce pain while getting a vaccine. Discuss your concerns with your primary care provider and determine which strategies work best for you. We'll show you a QR code at the end of this video for more tips. If you get aches or fever after vaccination, apply ice where the shot was given and use over-the-counter medicine for a day or 2. If you're worried about serious side effects, remember that the risk of serious problems is much higher with flu disease than with flu vaccine. Common reactions after flu vaccination include soreness, redness, and swelling at the injection site. Serious reactions such as anaphylaxis or Guillain-Barré syndrome, sometimes called GBS, are rare. The risk of getting GBS from a flu shot is estimated to be fewer than 1 to 2 cases per million flu vaccine doses administered. In summary, when deciding whether to get your flu vaccine, consider how getting flu might affect your life, such as missing work, the people you might spread flu to, and your own health and safety. We hope most of you choose to get your flu vaccine this year. And when you talk to residents in your care, remind them that flu vaccine is crucial because they're more likely to catch the flu and have a higher risk of being hospitalized or worse when infected. People 65 and older have more than half of all flu-related hospitalizations and 70 to 85% of flu-related deaths. Thanks for your attention and stay healthy. Here is a QR code for a flyer with pain management tips.